Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Before we get started, I just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has muted. We hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for in the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I'm going to introduce you all to today's guest speaker. Joining us today, we have Dr. James McKowen. Dr. McKowen is a clinical child psychologist working as clinical director of the MGH Youth and Youth Adult Addiction Program, also known as ARMS, as well as an assistant professor of psychiatry at Harvard Medical School. He is also the co-chair of the MGH Psychiatry Climate Change and Mental Health Committee and an associate at the MGH Center for Environment and Health. Dr. McKowen has clinical and research interests in the impacts of climate change on youth, specifically the mental health consequences. He is focused on solutions and interest in nature-based engagement for youth climate distress. In recognition of Earth Day, he joins us today to give a talk on the impacts of climate change on youth mental health. So please join me in welcoming Dr. McKowen.
Thank you so much, and happy Earth Day, everybody. A beautiful sunny day here in Boston. Hopefully it's warm where you all are. I'm thrilled to be here. Really excited to talk today about climate impacts on youth mental health. So let me go ahead and share my screen. Hopefully we don't have any technical challenges today. Okay. All right. So why is an addiction person interested in climate change in youth? It's sort of the question that I asked myself as I started to venture into this space about 5 or 6 years ago. Addiction has been sort of my bread and butter for the past 10 years, and I still work in that space, but have been increasingly concerned about the impacts of climate change on youth. We know that it is a big driver of social determinants of health, so making folks more vulnerable, more at risk for the consequences, and of course, young people are in that vulnerable group, as well as those with substance use disorders. And so generally to work in mental health in youth at the moment, paying attention to the climate and understanding the impacts of climate change are really, really critical. I'm also a nature lover and spend a lot of time in nature myself and find it really restorative. And that is also in part why I find this space really interesting. Okay, so today we're going to go over a little bit of the context of climate change, just to sort of level up on the science. I won't spend too much time in this area. It's super complicated, but I want to just lay the land there. Talk briefly about the implications of climate change, the impact on health broadly, and then talk a little bit about eco-anxiety, certainly a term that's been really vogue lately. Certainly in the past year, 2 years, folks have noticed it's in the radio, on the news, eco-anxiety, climate distress, solastalgia, a couple of these terms we'll go over briefly. Next step is to talk a little bit about why are youth more vulnerable generally, and then talk about climate-focused interventions. The reason for hope, because I think it's really important that we cover this side of the story. It's often doom gloom, and so I want to talk about solutions. And then wrapping up with my ask, which is my ask of you all who are joining us today. So climate change, essentially, long-term shift in global weather and local weather patterns caused primarily by carbon emissions and the greenhouse effect. We call it climate change versus global warming because the climate is changing in many different ways through heat, but also we get some polar vortexes happening, which we experienced in Massachusetts in the north, that is also connected to climate change, even though it's extreme cold. Heavy snow patterns also related to climate change, so it's not just about warming. How does this all happen? Well, essentially greenhouse gases, so that's carbon dioxide, methane, nitrous oxide are released through the burning of fossil fuels, which trap and sort of envelop the planet in like a blanket. And then solar radiation enters through our atmosphere and kind of gets trapped and gets re-radiated and that essentially causes the greenhouse effect. So sector contributions, so where is this all coming from? We know that there's different contributions for different parts of our world. Electricity, food and agriculture are about half, industry broadly, transportation about 14%, and then the remainder is other energy sources, buildings. And the share of that comes from coal, oil, and gas. So those are all what we call fossil fuels. These enter the atmosphere. Some of that is absorbed by the Earth itself through land, things such as peat farms, trees, those sorts of things. And the ocean actually is a huge carbon sink, hence why we are seeing some acidification of the ocean, because carbon dioxide causes increased acidification. And so mangrove areas of those sorts of things are also absorbing CO2. And then the remainder, about 60%, it remains in the atmosphere. And this is from a great organization called Project Drawdown that does a lot of work in the solution space. So what is the connection between greenhouse gases and the temperature? Well, we've seen since the early 1860s even, the carbon dioxide levels were quite low, and the difference from average was also low. And then we start to see, with the increase in the Industrial Revolution, the 80s and 1900s, we start to see the carbon dioxide level creeping up, and then really rapidly rising since about the 1950s and 60s, with real increase in fossil fuel use, transportation. And now we're about 420 parts per million, which is the term we use to assess the amount of carbon in the atmosphere. And we see that's highly correlated with warming. So where are we currently globally as a temperature? As you can see, it's been on the rise steadily. This graph at least shows from the early 2000s. And so presently we are around just below 1.5 degrees C, so it ranges a little bit. And I know folks don't necessarily understand centigrade, or I'm from Britain, so we use centigrade, but here in the US we use Fahrenheit. So we're around between 1.36 to 1.48 degrees C above pre-industrialized levels, around 2.48 to 2.64 Fahrenheit. Doesn't sound like a lot. It's only a degree or so, a couple of degrees Fahrenheit. But if you think about an analogy of when you have a fever or you're sick, like your body temperature is 98.6, and a couple of degrees difference, 100, 102, not a lot of degrees change, but actually you feel pretty unwell. And so I like to use that kind of metaphor for the planet. It's a couple of degrees change, but it is a big shift in what is happening. So what does all that mean? 1.5 degrees C, 2.46 centigrade. These are some purported consequences when we think about these slight temperature changes. So we're hovering a little bit below 1.5. The past 10 months have been the warmest on record for thousands and thousands of years. And so we see some impacts on droughts and wildfires. Some of the wildfires have affected us here in New England. We've seen rising smoke happen to us last year. And so we're seeing some increases in wildfires and drought, so food production, impacting sea level rise. The sea has already risen a little bit. Some of that actually is through carbon dioxide absorption. It causes the ocean to expand. And so some of that is already because of CO2 in the atmosphere. And then nature I'll talk about later, but certainly we're seeing effects on animals and coral reefs, increased bleaching rates. And as you can imagine, this gets worse with the temperature rising. And so these things will just get more severe and more frequent as our global temperature rises. So targets, we hear a lot about those. COP22, the Conference of Parties, which is a global collective action attempt by everybody around the world to try and address this. So targets are thrown around. So what does that even mean? I think it can sometimes get confusing. So the global target is what was the Paris Agreement, which was agreed upon in 2015 to keep global heating to 1.5 degrees C. Unfortunately, we're not really on target currently. As you can see, our current policies here in the blue push us close to 2.5 to 2.9 degrees of warming by the end of century. So if you remember from the previous graph, that would not be a great picture, right? So if we're close to 3 degrees, we're looking at 97% of wildfire increase, great extinction rates, sea level rise by 7 or so meters, a real nightmare, and we don't want to be in that position. But, with pledges and targets, we might hover at 1.8 to 2. Still not a great picture, but much better than higher rates. And if we really work on targets globally, we can definitely meet the 1.5. And so I think that's everybody's hope presently to try and really push these targets in this kind of decade and next decade as well. So what are the consequences of global climate change? I'm not going to really talk about economic consequences today. I'm going to focus on weather, biodiversity, health, and then obviously mental health. Economics is a much more complicated beast than I am qualified really to talk about, but there's certainly a lot of information on the economic consequences of not reaching our agreements. So really quickly, difference between weather and climate. I think this can confuse people because people say, well, it's snowing here, or it's raining, or it's sunny and cold. How come, it's changing a lot. So how does that connect to climate? So when we think about weather versus climate, weather is really the short-term state of the atmosphere, which does fluctuate, right? We can have heat waves and then it can snow. And so that is short-term consequence. And that changes within hours or certainly minutes here in Massachusetts. We can have sun in the morning and snow in the afternoon versus climate, which is really the long-term shift in our weather pattern. So these are kind of average weathers over many years in a specific place. So now we're seeing changes both in the short-term weather, but also the long-term climate. So it's just helpful to understand the difference between weather versus climate. So Massachusetts, what does that mean for us? It's interesting. This is a really, I think, evocative figure from NOAA that looks at sort of Massachusetts, where it was in the 60s and previously up until the 1999. And now we're sort of currently we shifted. Some of you who may be gardeners or pay attention to sort of the zones of gardening may be aware that the zoning of different gardening and temperature ranges has shifted. So we've actually moved south. So currently we're sort of on par with sort of New York and lower New York. And so if we reach Paris Agreement, we're going to be kind of continuing to drift south. And if we continue without really much change, we can imagine the projection of Massachusetts being kind of North South Carolina, northern Florida, which on the one hand you might think, well, it's kind of nice to have warm weather here in Massachusetts, but remember, everybody would shift south. And so we'd have a significant change in our global weather systems and what that would mean for us in terms of food productivity and sea level rise and other issues. We also see real increases in the number of disasters that have happened. So this is data again from NOAA from the 1980s. We can see the trend of increasing frequency and intensity of storms. This figure shows the number of events on the left over time on the bottom over to 2023 and the cost in billions per weather event. So we know that global climate change causes oceans to warm, which causes more evaporation. And so then you have higher amounts of moisture in the air. And so that is why we get more severe storms. Warmer oceans correlated with more frequent hurricanes and storms. And so that's why we've seen some of the changes there. So that can start to affect our vulnerability in Massachusetts for increasing storms, as well as the cost of storms. We've certainly seen that really get a lot more significant. Insurance is charging people more to insure their home if they live in a wildfire area, if they live on the coast through sea level rise or oceanographic storms. So it certainly is causing some impacts there. Importantly, I want to draw folks' attention to what are the consequences for weather changes for our health and our mortality risk. Interestingly enough, heat is the biggest concern that we have. It is the largest weather event that causes highest mortality rates, much more significant than hurricanes, which might surprise people. Flooding, not as bad, and we can see the numbers drip down. Tornadoes, but heat is really problematic. So we've had some heat waves in New England, certainly. Sometimes it feels good to be in the 90s, but when it lasts for days and days, and you live in an urban area with not a lot of air conditioning, or you're a vulnerable person with health issues, disabilities, your ability to cool yourself gets really compromised. Folks that are homeless, mental illness, they're much more vulnerable to the impacts of heat. And so the elderly too. And so that's why we get really concerned about the impact of heat and heat waves on our health risk. So let's talk a little bit about biodiversity. There's obviously a connection between climate change and biodiversity loss, unfortunately, mostly because the practices that have led to carbon release through forest deforestation or land to produce cattle and other types of foods result in carbon being released. Trees are an excellent store of carbon. They pull carbon from the atmosphere and obviously release oxygen for us to breathe. And so as the land gets cleared or we clear land for mining or other issues, it really impacts local biodiversity. They're also vulnerable to heat and weather changes, right? So animals have to thermoregulate just like we do. And so the hotter the temperatures, more droughts, land loss is causing some current biodiversity loss. And we can see this data from United Nations predicting that, at 3 degrees C, 41% of mammals losing half their habitat. That's frankly quite a scary situation to be in. And so we also have to be thinking about biodiversity when we think about the impacts of climate change. We have seen a rise in extinction rates, unfortunately, driven mostly by human activity. And so we can see since the late 1800s, early 1900s, a real exponential increase in extinction. A lot to do with many different factors, climate change being one of them, just humans moving around the globe, taking different species with them, invasive species affecting local species, transmission of different fungi, there's different issues. But generally, there's a strong connection between climate change and extinction rates that we must be, also be paying attention to. All right, so good news is that these are some things that we can work on. There's lots of people around the globe that gives me a lot of hope, really working on conservation efforts. So we know that this chart shows us here that, we've had some historical species decline, right? Some argue that we're heading into an Anthropocene era, resulting in sort of increased extinction rates of many different species. We've certainly seen bird species decline. Folks who remember, maybe a little older, remember driving their cars, used to get covered in insects in the summertime. You don't see that so much anymore. Your window screen is kind of clear, and that's a little disturbing to think that even during my lifetime, I remember as a kid, car would be covered in insects, and now you don't see that so much. And so that's a really concerning situation. Again, climate change, habitat loss. But with conservation efforts here in the green, we can see that if we really work on sustainable production, restorative agriculture, reducing pesticides and chemicals, even in our own backyards, growing native plants, we have a chance really to really improve species diversity, which is really important for our own health and wellness. But if we really are behind on this, we'll see that the business as usual approach will result in really increased extinction rates. So we have to be paying attention to really trying to get our own carbon footprint down, but mostly working on the systemic issues through voting to try and address both biodiversity and our own, the own impacts of climate change. So health impacts. This is, we're a hospital here at Mass General, and so we're focused on wellness and health. But we know that global climate change is really being talked about as the greatest threat to public health in the 21st century. This has been reported by over 200 journals, including some of the big ones, JAMA, British Medical Journal. A real concerning picture here as to the health consequences of climate change. Of course, we think about storms and weather and those different issues, but really this is going to come home to roost with how it affects our own physical and mental health. So how does climate change impact health? So like I mentioned earlier, climate change is sort of a threat multiplier as we talk about it. It increases risk, it increases the impact of social determinants of health. So folks that are already vulnerable are going to be more vulnerable through the impacts of storms, heat, other types of challenges. There's several different areas in which climate change might impact our health. I'm just going to focus on 3 here, which I think kind of resonate more, but certainly it can impact lots of different areas. So if we think about zoonosis, so that's a technical term for just a transmission of viruses or illnesses from animals to humans. We were all aware of bird flu, right? That was something that impacted Massachusetts several years ago. COVID-19, Ebola, these are viruses that live endemic within animal species. And as humans encroach on their space through deforestation or expansion, we come more and more into contact with these species. So again, it's not, so people are more exposed to these illnesses. We're causing more people to get susceptible to these illnesses because they may be exposed to other aspects of climate change. through heat, through flooding, through drought, these other issues. The mass farming of certain animals also increases our risk of the transmission. So respiratory illnesses, this is a really important one to be talking about. So we know that fossil fuels release both fine particulate matter as well as ozone, which is sort of ground ozone. Both of those factors are really harmful to our breathing apparatus. So fossil fuels release a chemical called PM 2.5, which is a fine particulate matter. So we're seeing increasing rates in children of asthma. We've seen examples of, when we had the wildfire smoke from Canada, when we were back to wearing masks, we really couldn't go outside, particularly if you're someone with COPD or cardiovascular issues. These all impact your vulnerability to exacerbation of those health issues. So really concerning. We see in other parts of the world, Delhi, the most polluted city in the world, it's really hard to see the Himalayas in the background. We know that fine particulate matter really gets into gets into our lungs. It's been found in placenta, it's been found in the brain. So really, really concerning impact on our system broadly, but also on our ability to, respire and breathe. And then lastly, vector-borne illness. So Massachusetts and New England, we're all super familiar with Lyme disease, but we may be less familiar with these other ones, Zika, dengue, malaria. So Lyme disease has also been shown to increase as the planet warms because it's starting to move up north. We also know that snowpacks are really helpful on killing tick-borne illness, and so we've had less snow. We didn't get much snow this year. We got some good snow up north, but that varies a lot. And so generally snowpack is what kills tick-borne illness, but that is unfortunately less happening now. We're also seeing some of the shift north of these other diseases that we really just thought about as happening in South America, Africa, South Africa. We've seen some increasing rates of dengue transmission in California, Texas, and Florida, likely through warming as well. Okay, so let's talk mental health. So when you talk about mental health, we talk about direct effects, indirect effects, and then just broad psychological impacts. So the direct effects is sort of like when there's a storm or there's a heat wave that happens, we know that heat really impacts mental illness. So we know when we look at rates of suicide when it's hot in the summer months, they increase, unfortunately, as does violent behavior. And we do see that heat can exacerbate other types of mental health exacerbations, right? When I'm hot, I'm cranky, I'm irritable. If you already have a bipolar disorder or you have other sort of severe mental illness, that can really kind of exacerbate your symptoms. People also might struggle with what we call thermoregulation, which is sort of regulating their heat. It could be hard to cool if you don't have AC or you live in an urban area without tree coverage. So that can impact our sweating. We know certain psychiatric medications can affect our ability to sweat or our kind of metabolism. And so we see that folks who have a psychiatric illness struggle with thermoregulation and may have difficulty cooling. We also know that psychiatric medications can affect temperature regulation. So antipsychotics, antidepressants, so Prozac, Abilify, anticholinergic medications can already affect our ability to thermoregulate and modify our heat. And so we can see that those can get exacerbated and may be less effective or make it harder for us to cool. So indirect effects, we talked a little bit about those earlier. Those also have been associated over time with increasing risk for mental health challenges. So we talked about PM 2.5 and atmospheric pollutants. They can be associated with neurodevelopmental risk, neurodegenerative disorders. We've seen some correlations between air pollution and increasing rates of dementia. Proper micronutrients. So as we know, nutrition is really critical, right, for our overall health and wellness, particularly when we're raising children and we want them to have nutritious meals. But global climate change is resulting in poorer soil quality. And so some of those micronutrients are less in the foods in certain areas that people consume. And so that increases risk for vulnerability to mental health issues. We also know that certain infectious disease, so vector-borne illnesses that I mentioned, can actually be associated with neuropsychiatric sequelae. Certain viruses can cause neurological problems. And so we might see some increased transmission of those as the planet warms. So in more sort of broadly psychological impacts, we think about acute trauma, right? So a disaster happens, a hurricane, a flood. We can have rates of post-traumatic stress disorder increase, substance use as a way to deal and cope. We can have chronic trauma from displacement. We call environmental refugees who have to leave their place through flooding. Their environment has changed, their crops failed, they have to move, exacerbating civil unrest as well. And so we know through acute traumas can be a consequence of climate change. We know that for kids in particular, the rates of PTSD after a natural disaster, depending on the research study you look at, between 3 and 40%. So that's, diagnosed post-traumatic stress, for example, after a wildfire, after a flooding, hurricane event. We know after Hurricane Katrina back in, I think it was 2000s, maybe 2010, I forget the date, I apologize. But basically, we saw a lot of increased rates of PTSD and depression. And that's really exacerbated when you have poor access to healthcare. So those most vulnerable have higher rates of PTSD, anxiety, and depression, who are already, not able to access great care, don't have primary care doctors or insurance. We know that they have high rates of PTSD and depression after weather events. So what about climate distress? So we think about this as everything kind of else, right? So you might have had an exposure to a trauma through a hurricane, or even not even meeting PTSD symptoms, but really had exposure to a flood, which ruined your community or cost you a lot of money, and so that can be very, very stressful. But not all of us, fortunately, have experienced direct effects of climate change. But many of us are sitting with sort of this existential worry, concern, anxiety. And so there's a lot of that terminology spinning around climate grief, eco-anxiety, what's called solastalgia, which is essentially a place that you used to find healing or meaningful, kind of is tainted now or no longer is that way. So some folks struggle, they used to go to a forest, but it burnt down. And so now they are struggling with this sort of solastalgia, sort of low-level depression, or those sorts of feelings. We got to be careful though. We don't want to pathologize this. So I love this cartoon. It really captures the moment that, the patient's visiting their physician and he says, so here's your problem. It looks like you've been paying attention to what's going on. And so that's what we think about with the existential anxiety. It's a sort of normal response to what is happening. It's not a mental illness. It's not a pathology. You just got your eyes open as seeing a lot of scary things happening, or you have a lot of worries about that. And so when we think about the definition, I think it's makes sense to call it broadly climate distress, which is a reasonable reaction to the awareness of the climate crisis and worries about the current state and future of the planet. The DSM-5, which is our kind of handbook as psychologists and psychiatrists, there is no mental illness connected to climate. The American Psychological Association does call it a chronic fear of environmental doom. And a study by Hickman in 2021, which I'll talk about in a moment, really does underscore that this is not a mental disorder. It is an emotionally healthy response to reality. So I think that's really important to really underpin here. Hickman, who I just mentioned, she is a researcher and therapist out of the United Kingdom. She's done really a landmark study in 2021, surveying about 10,000 young people globally in 10 different countries, asking them various different questions about the climate and more specifically the mental health impacts on climate. So these were 16 to 24-year-olds. Concerningly, about 67% report feeling sad and afraid of climate change, and 56% report feeling powerless. And you can see there's other emotions that they surveyed here, angry, helpless, guilty, hurt, various different emotions. So the majority of young people are experiencing this currently. What's good about this study is that it was global, so we're really United States, South Asian countries. So it's really a kind of a good sample, representative sample of young people. They also found, unfortunately, that 83% of young people feel that people have failed, that the future looks frightening. And I think a surprise to everybody was almost 40% are hesitant to have children. So they're concerned so much about the future of the planet that they're questioning their own family future. And I think that's quite a sobering statistic to see. So why are youth more vulnerable to the impacts of climate change? Well, we know their exposure to the impacts of climate change is just a longer period of their life course, right? And so although climate change has really been happening, as I mentioned earlier, since the really took off in the 50s and 60s, a majority of the current significant consequences are going to be a bigger portion of their life as they look to be living into the late 2100s for kids born today. And so they are going to be exposed also during more key developmental phases. So infancy, we know that PM2.5 is being found in the placenta, and so that's passed on to infants before they're born. We know they can be exposed to air pollution at earlier ages, which is going to have a much more significant, longer consequence. And so those are some concerns about how it impacts their kind of longevity and their overall life course risk. We know that kids also have different cognitive and emotional capacities, and so their ability to understand what's happening is different, right? Their ability to comprehend emotionally is also quite different than adults. They tend to obviously not have the same amount of information. They might not know what's happening, especially with migration or displacement or flooding, those sorts of issues. So their ability to cope is different. They have different needs developmentally and different emotional needs, but generally less control of their lives, right? And more dependent on adults for support. And so that can exacerbate their ability to cope if they are in a household that's been displaced or their parents are struggling with significant exacerbations, both health and mental health from climate change. That's going to affect their vulnerability as well. And then something I've been thinking about is that kids, a lot of kids' stories we read to kids in bed, it's about animals in the forest and all those sweet things. And then, when they see or hear on the radio when you're driving them to school, or they notice that there are fewer animals around, it's just a big part of their narrative development of their storytelling. And so I think there's a risk that they're going to be impacted by things like that biodiversity loss and these consequences potentially more. I don't know yet. It's just a thought I have around the impact of climate change on nature. Um, some of my clients that I talk to are teenagers, talk a little bit about this concern. They see fewer animals, or they know that extinction is increasing, and they're 13 and 14 and 15, and that I think is really concerning to them. So switching gears to talk a little bit about how to support young people through interventions and sort of resilience building. Um, And so I have a journal article under review with a colleague, Dr. Wurtzel, where we looked at the climate change impacts on pediatric mental health. And we looked at interventions and resiliency building strategies. And generally, they fall into kind of three buckets. There's an approach that's used at providing education, so helping them understand what climate change is, how it impacts the environment, um, and learning about that, so giving them tools and knowledge, because I think that's powerful and important. The second bucket is really nature-based engagement, which is where I'm particularly interested in. So both using nature and eco approaches to help them connect to their environment, as well as nature restoration approaches, which I think can be quite useful for kind of mitigating some of this anxiety and distress, and helps them with something tangible and something that they can see grow and improve, and they can prevent environmental degradation as well. And the third bucket is really activism. We've seen a lot of youth activists manifesting. Greta Thunberg has really put that on the map. But environmental activism has been going around for decades, but really is the fore more recently with youth protesting and marching. So we'll talk a little bit about, does activism help? Is it something that actually supports emotions that stem from climate work? And so across these different buckets, we do emotional work, right? As working through their anxieties. Group-based care is particularly helpful for young people and kids. Very social, their peers are their kind of primary kind of goal. And so building that community can be really great. And then really, and especially in the activist space, but really having youth co-lead or youth-led interventions and support approaches is really important as well, to kind of support their sense of control, as well as they're the generation that's going to be mostly affected, and so their voice needs to be at the table as well. So we think about what are the parts of support interventions that are effective. As I mentioned, we've got emotional coping tools, so building their ability to understand climate-related emotions, how to build meaning and hope. Also kind of hear and listen to their concerns and stresses. Connecting with nature, as I mentioned, can be really helpful. We know green space improves mental health and wellness, and I'll touch on that. Climate action activism, and then climate justice. So remember we talked about certain populations, specifically people of color, are much more vulnerable to the impacts of climate change. We know they're actually more distressed and anxious than compared to Caucasian or wealthier populations um, uh, about the impacts of climate change. And we know that really to address climate change, we also have to be addressing racial inequity and systems of oppression to really address the vulnerable. So quickly about disasters. So I mentioned earlier, right, the impacts of extreme weather, weather events, flooding, wildfires, hurricanes, those sorts of things. If there are any therapists or mental health providers, physicians on this meeting, I encourage you to get training in psychological first aid. This is put through by the National Center for Child Traumatic Stress. And it's an online training, and it helps you become a psychological first aid responder, which could be really great in your community to help folks in a disaster cope psychologically with what is going on. And so you can register and sign up to be notified. I completed that training, and I think it's really great. Interestingly, a recent game actually came out, a video game, which is really smart when you're trying to engage kids and teens on helping them prepare for disasters. So it's through iThrive. It was done in partnership with FEMA, so the Federal Emergency Management Agency. And so it's called Disaster Mind. And it's sort of a video game platform that helps young people work through how to cope when a disaster strikes, if a disaster strikes. Again, we want to not cause them to be anxious and worried about something, but we want them to know where the fire escape is should there be a fire. And so it's just about helping them be more prepared. And importantly, having some strategies and knowing what to do in a really unpredictable moment can actually be quite protective. So that's why I think it's actually quite helpful to help to have young people kind of work through this. It's free also. So you can check that out. I'm happy to provide information about that later. So when we think about emotional supports, there's some great resources out there. The Climate Mental Health Network has done a lot of work in this space. Climate Psychological Alliance, which I'm a part of, we have a youth subcommittee, as well as just other folks that are working with this group to create accessible kind of ways to sort of talk to young people about their concerns about climate. This climate emotions wheel came out of some work by Dr. Pikala out of Finland, put together this sort of climate emotions wheel can just be a way to think about where is someone, what are their feelings, what are they going through. Importantly, it's not just about bad, doom, sad, anger. We also talk about positivity, gratitude, hope, how to think and build resilience. But it's just helpful to start the dialogue to see where someone might be. You might also, as an adult, wonder where you are on this wheel, and depending on the day, you might be positive, gratitude, and another day you might feel shame and guilt. And so it can vary, but it can just be a good conversation starter. There's also some literature out there that's been produced. This is a great climate guide for kids. It's done in a comic form, which is a nice thing to kind of work through as a young person or read through with your kid if you want to. This is by Lauren Sommer and Michaela Harib. So you can check that out, and I'm happy to provide the resources for this too. Climate-aware therapy is something that's building. Again, this is not a mental illness, but sometimes having a space to talk about this with a professional can be helpful. We know people with already existing mental health issues, anxiety, generalized anxiety disorder, depression. Part of their exacerbation may come from the climate. And so being informed as a mental health provider about climate therapies, climate interventions, talking about nature connection. This is done by a really great psychologist, Dr. Thomas Doherty, who runs selfsustain.com, and he provides climate training. I've done it myself. It's really a great course. You learn about environmental identity, ecotherapy, how to help someone kind of navigate some of the climate anxieties and distress. We know that it's really important to talk about this because that really can block someone's sense of um, moving forward. If you're really stuck in despair, paralysis, you can't get into action. You can't move into making change because you're too stuck. You're kind of fight or flight. And you're often in the freeze position too, where you don't know what to do or where to go. And so working through these emotions can actually unlock change. And so I think it's helpful to seek that out if you're particularly bothered by this. It's sort of, you can't let it go. You can't sleep at night. It's getting in your way of functioning. It may be helpful to seek out climate aware therapy. Transformational resilience is another excellent intervention approach by Dr. Doppler. So this is evidence-based strategies to help with climate change and the impacts on our mental health. It really is solutions focused. It's trying to build resilience through resilient growth. The approach is called presencing and purposing. So it's being in the moment, not too getting caught up in the future, really working on what you can do at the moment, finding meaning and purpose. And so it shifts the approach really from reacting to trauma to really transforming through it. So finding meaning and finding connection, finding community, and being able to kind of grow through the challenges that we're facing. So definitely there's some trainings on that. There's a great book you can look into as well. Climate cafes. This is something that's I do myself. In fact, just a quick plug, we have a climate cafe at the Blum Center on, I think, June 26th at 11 a.m. if anybody wants to come. It's open to the general public. It's just a space to talk a little bit about climate. The goal is not to fix your concerns. It's not therapy. It's not an intervention. It's just a space to connect with others. Many of us sometimes feel alone in this. Am I the only one that's worried and anxious? We actually find out that most people are. Over 70% of Americans are concerned about climate change. So often we don't think that other people are paying attention, but a lot of us are worried and concerned. So it's a free space that will be kind of exploring this, just sort of a place to talk about this. So definitely connect with Amy about registering if you're interested in that. But it is limited space. Nature. So as I mentioned, nature engagement, we know there's a lot of benefits from mental health and nature engagement. We can help with our cognitive function, our mental fatigue. Research suggests that engaging with nature, viewing a garden, being in a forest can actually help with our cognitive performance. When I go out in nature, I definitely feel a relief. It's just really nice. I was talking to one of my clients last week. Difficult school day, really struggling. He's on an IEP. He's got panic attacks. We've been talking about accessing nature because he lives in a pretty rural area. So he took himself off for a hike. Really felt so much better after that. So we know that helping young people engage in nature can be kind of helpful and restorative. And nature's been shown to really reduce exposure to pollutants, right? You go into a forest, it's clean air, it's green, it just feels great. And we know that certain areas of our city, right, we call them heat islands, where trees and plants are not present. We know that heat is much higher. So really, I'll talk a little bit about some nature restoration in a moment, but if we compare areas which are just sort of concrete, tarmac, no trees, the heat is really quite different. It can be as much as 30 degrees centigrade. It's huge. We know green coverage results in fewer heat deaths, fewer ER visits. It's great data coming out of Boston University by a colleague, Amita Morisama, who's done some work looking at heat effects in New England. Really, Boston area, we know certain towns, Charlestown, Mattapan, Dorchester, fewer tree coverage compared to the wealthier neighborhoods. So unsurprisingly, they have higher rates of ER admissions, higher rates of substance abuse admissions, more behavioral problems. And she's done really good data controlling for a lot of different factors here. So we know that it's about heat exposure during certain months. I work with a couple of these awesome agencies. So Youth Urban Green Restoration, just so you know, there's a canopy crew in Cambridge, Massachusetts, Boston National Parks. We've got Yes, which is Youth Enrichment Service out in Boston, and then Black to the Land. So these are all organizations that work with young people to really engage in nature restoration. We know that nature restoration is healing and helpful. It gives people a sense to plant a tree, see it grow and form a community around improvement. So we know that this is really a great thing to be doing for young people as well as our environment and helps with their climate anxiety. Lastly, I'll talk about youth activism. So does it work? This is a really funny uh, photo, which really captures what youth activists are feeling. I've talked to a couple of youth activists, and this sort of kind of encapsulates it. So often seen as inspiring, but that's kind of it. There's not a lot of support they feel, and they feel kind of left to the sidelines. And so struggling with a lot of anger and resentment towards older generations and politicians in particular. So there's a lot of youth global organizations if you're interested. Sunrise Movement is a huge one. COP28 this past year was a huge push for youth. They had a youth global statement. I've got Indigenous Youth Network, Fridays for the Future, which is Greta Thunberg's organization. Youngo, which is another young people's UN group, which young people can join. They were also at COP28 this year, and then Zero Hour, which is another activist organization for youth. It's just a great way for them to get connected and learn how they can support and help change. Importantly, does it help, right? So what we want to do is encourage young people to, if they're interested in this, get active. And that can be marching in the street, or it can also be making a climate alliance in your high school or your middle school. It can be doing a trash pickup day. It can be sending a letter to your mayor, various different forms of what activism looks like. But we wouldn't want to push that as an approach if it actually can be harmful. Without paying attention to climate emotions, so grief, uh, fear, anxiety, if we kind of leapfrog that and just move to activism, I think that can be unhelpful. Um, but fortunately, getting involved in activism seems to be a buffer. This was a study done in 2023 by Schwartz et al. Looking at does activism impact climate change anxiety and emotional impairment and depressive symptoms. So fortunately, if young people have high symptoms of depression and high anxiety about the climate, engaging in rates of activism seems to be protective and a buffer. So that's encouraging to see. But again, we got to caution, we can't just push into activism space without helping manage emotions, because that can result in a lot of burnout, as well as just sort of a sense of fatigue. All right, last couple of slides, just want to touch on parenting. This could be its own talk, but parenting through the climate change, right? As parents who you may be here, we know that lots of parents think that kids need to know about this. You can't really avoid it. It's on the radio on the drive to school, it's on the news. Other kids are talking about it. Kids experience heat waves, but only half of parents have kind of talked to their kids about it. But many kids know about it, like I said. It's not so straightforward. It can be complicated to talk to children about this, right? We've got developmental age. You talk to a 17-year-old really differently than you talk to a 6-year-old and a 9-year-old. So you really have to be thinking about their development. Where are they on the cognitive developmental spectrum? You might not know all the facts. There's a lot of confusing information out there, misinformation. And so that can be a barrier too. It's sort of a controversial topic depending on kind of where you are and what you see. It can be a tricky thing to bring up. We certainly don't want to make kids anxious about this. We don't need to say, you need to be anxious about climate change. What are your anxieties? We don't want to do that. We want to understand if that is something that is a worry for them. Uh, Parents might feel, shouldn't I protect them? Shouldn't I not expose them to these sorts of fears? I should shelter them from the news. I should not let them learn all these different things. And so that's another concern I think parents experience. You may have a lot of your own emotions, right? You might have guilt and anxiety. And so I suggest that if you haven't kind of done some of your own work, it probably isn't a good idea to then talk to kids about it, because you could lead in with a lot of anxiety and guilt and stuckness and feel powerless. And so we wouldn't want to have kids therefore feel that too, because that's going to actually be harmful. And so you might also not therefore know any solutions to cope. You might just be stuck and not know what to do with this. And so that's not going to be a very productive conversation. We want to be balancing the truth with also hope and solutions focused, I think. Great resources out there for parents. There's a lot of good parenting books. Cat Kid is awesome. You can check that out. It's a website. They have some kind of games and tools to use for younger kids. There's Mom's Clean Air Force, which is a real driver in activism for parents. There's climate parent fellowships that you can do. So these are just some books out there that you might want to read or get educated on, and build your community with other parents around these sorts of issues. And then lastly, this is a nice resource if you're in Boston area. You can get this from BMC, Boston Children's Hospital. It's a guide. You can use the QR code or look at their website. Just some general information on resources for parents around climate change issues. All right. Lastly, almost done, and then we'll do the Q&A. Reason for hope. All right. So this is really important. We have already bent the temperature curve. We are probably quite far away from 4 degrees. I think we're really moving in the right direction. So I think that's important to know. We're certainly seeing some increased awareness of the health impacts, right? And so I think that's getting people motivated into action phase when we think about the consequences on our own physical and mental health. Youth event interventions are emerging. We've got a lot of strategies to support young people and build resiliency. Activism seems to help both locally and globally. We've seen that to bring attention to these issues, especially from the voice of young people. Lots of resources for parents out there, as I mentioned. And then each of us can identify our climate action. So this is my last slide for you all is I want you to think about what is your climate action. So this is a great image from a marine biologist who's one of my favorite people in this space, Dr. Anne Elizabeth Johnson. She simplifies what you can do into what gives you joy, what are you good at, and what do you think needs doing locally, globally? And that kind of overlap is your climate action. So I want you to reflect and think on that over today and the next couple of days or weeks. What can you do? Everybody can do something. Every job can be a climate job. But again, you can do things that are small and that's important and meaningful, as well as we try and address the bigger issues. So thank you so much, everybody. These are some resources. If you have questions after this, feel free to email me. Here's some resources on this website. So I will stop there and we can turn it over to Q&A, Amy, if that works.
Thank you. If you have any questions, feel free to enter them in the chat. I have a question regarding tips on how parents can have a conversation with younger kids. For instance, an 8-year-old who have questions about climate change.
Yeah, great question. So I generally start with curiosity, right? So tell me what you've heard. How did you hear about this? Was it, in class or from your friend Sally? Just sort of ask them a little bit about the origin of where this came from. Um, and depending on what they answer, you may be able to sort of share, yeah, this is definitely something that's happening. And we know that humans are, and it's just sort of to give them a little bit of information. I generally say stay away from the fear and the scariness of it all. Like I said, we don't want to deny that that's true, but we certainly don't want to get stuck in that with them as well. So things like, yeah, lots of people are worried about that, as things get hotter and these are some things we can do to work on it as a family. We can make sure we maybe ride our bikes more and use the car less. Maybe we stay local for vacations and don't always fly. Maybe we need to look at what we eat in the home. What do you think? Just really bring them into the conversation with some tools and strategies for coping and for feeling a bit of control. But certainly the language you use is going to be different than a 16 or 17-year-old, right? As well as maybe a 5-year-old who isn't likely aware, but may be affected by disasters or other issues.
Thank you. And you provided many great resources. Are there any specific ones you recommend for younger kids?
Yeah, Cat Kid is a great one. They have a website. I'm happy to send that out. Take a look at that. There's some readings on there. There's some games. The comic I mentioned is more for middle school, early high school. But there's some really great tools. I'm happy to send those out for younger people. But sorry, for young kids too. There's a great book actually, Dr. Wurtzel, my co-author on the journal, wrote, which is for younger kids called Coco's Fire, which is a story of a little turtle, and it's really well done. He's a child psychiatrist, and so you can look that up. It's a really good story about climate, but also hope building. Yeah.
Thank you. And for those who may be healthcare providers joining today's webinar, do you have any tips on how we can support as healthcare providers, support parents and children?
Yeah, great question. I'm so glad to hear that one, right? As pediatricians or psychologists or other folks, we encounter people that may bring this to our clinical space. And so um, I generally, again, opening up the conversation to ask them what their concerns are, what their worries are. It could be something like they don't have AC and it was really hot last summer, or their child has asthma and what do I do? How do I, navigate it if there's another wildfire? So things like accessing AC units is available through the state, as well as kind of air purifiers for low-income communities. Um, but for healthcare providers, there's really good training you can do. There's Eco America and Healthcare Without Harm puts on a training. You can be a kind of a climate ambassador, and you get a little badge that you can attach to your ID, and that can let a client patient know that you are someone that can talk about climate change and provide them with resources. I've done the training myself. It's great. Happy to share that information. And then your specific kind of specialty area. I was a climate conference last year where every specialty of medicine presented on the climate impacts for their specific area. So pulmonary, neuropsychiatry, OB-GYN, they all have subgroups within their different medical specialties with tips and information on how to support patients, depending on the particular health issue or health space that you work in.
Thank you. And while we wait to see if there are any questions, additional questions in the chat, do you have no final thoughts you'd like to share with the audience?
Well, I just gave a lot of my thoughts and perspectives, but I'm just thrilled to be here today and get a chance to talk about this issue. It's really become a real passion of mine and area that I'm looking to kind of continue to work in. I will say that we are not alone in this as healthcare providers or parents or other people. Like I said, a lot of people are concerned about this. As healthcare professionals, we are starting to build our own climate mental health initiative within the Department of Psychiatry, APA, pediatrics, depending on your area of specialty. There are other people who are worried about this. The Center for Environmental Health at Mass General is doing a lot in this area to improve the carbon footprint of the hospital, improve plastics use, diets for patients. There's a lot happening that we're often not aware of. And as I became educated and as I became more active in this area, it really helped my own climate distress. This was not something I was not experiencing myself. And so I have a lot more reason to hope than I ever did because I know I have a community now and other people working on this too.
Are there any web resources one can go to visit to learn what Mass General is doing?
Yeah, you can check out the Center for Environmental Health website if you just Google that. And there's a great podcast that's out by Dr. Winnie Armand called Sustaining. Ooh, I'm spacing on the name right now. But basically, I think she's in a second season and she interviews various different people with MGB. So anesthesia, who are working on their gas release, surgery, on nursing, psychiatry. So it's a great podcast you can listen to. If you Google Center for Environmental Health and Dr. Winnie Armand, and I can send that out to Amy as well. The podcast is really, really great. There's a lot of work done in residency education. They interview some residents looking at to increase climate training within their class. So yeah,
Wonderful. Thank you so much. We are at time. Thank you so much for spending the hour with us, Dr. McKowen. This was great.
you're so welcome. And thank you everybody for being here. And please do reach out if you have any questions. I'm available as a resource. So have a good rest of your Earth Day.
Thank you. And for those who joined a couple minutes late, I did make an announcement that today's session is being recorded. It'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a the rest of the day.
Bye.